If you're wondering whether your home can be an ideal place to carry out a physical rehabilitation program after having a stroke, then this video is going to be very beneficial for you. Hi there, I'm Dr. Kenneth Monaghan. I'm a university lecturer, a neuroplasticity expert, and the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm hugely passionate about trying to help caregivers and stroke survivors to adapt their home as an ideal place to carry out their physical rehabilitation after they've had a stroke. And of course, one of the disappointing things that I've heard over the years from caregivers and stroke survivors is that when a stroke survivor gets discharged home, the, the a huge, overwhelming feeling hits them that that's the end of their, real ability to recover because they're out of that rehabilitation environment. And this is a very important message to get across: is that your home can become a hugely beneficial place, which we'll discuss now in a few minutes, and that it's the next step towards your recovery. So certain things can happen when you're in a physical environment like a rehabilitation center and in a hospital, but also certain other things can happen when you're in your own home environment. So memories make our homes, and we feel comfortable in our own homes. I know myself that it's being within my comfort zone when I'm in my own kitchen, when I'm in my own house, because I know where everything is, and I know the sights and the sounds and the smells. So my brain can relax, I can relax, and the actual environment inside my body changes because I'm in that space. How many times I've been away on holidays, staying in apartments or staying with friends, and you feel so uncomfortable because you don't know where anything is. It's actually a little bit stressful, if the truth be told. Now, Professor Nancy Mayo from McGill University in Canada, she has written a fantastic report, a fantastic research paper called Stroke Rehabilitation at Home, Lessons Learned and Ways Forward. And one fantastic finding that she reports in that paper is that an experiment was done with stroke patients where they were divided into two groups, and one group was given a supervised program at home for 1 week by a healthcare professional. And then afterwards, the caregiver or spouses or family members took over for the next 9 weeks. And that was compared against a program that was done for 10 weeks with health professionals only. And what they found was that the outcomes were almost identical from the two programs. And this is an extraordinarily interesting finding, and something that should give caregivers and spouses and family members great confidence to know that. So what's missing is the roadmap or the information that gives you the confidence, gives you the insight into what programs need to be done. And that's the reason that I wrote Lights, Mirrors, Action, because this information is not in abundance out there for people. So can we make your home a better rehabilitation centre? Yes, we certainly can. And as I said, patients sometimes are very disappointed to be back in their own homes because they think that that's the end of their real high quality ability to recover. But research is showing us that you don't need fancy equipment to create neuroplasticity in your brain. You don't need to have high tech equipment. Now, as a disclaimer, just to say that some patients will have huge disability, and it may not be feasible or possible for them to come home and do the physical programs that I advocate in Lights, Mirrors, Action. But for those that can, know that innovative therapies that we've discussed in previous videos and that I work on and research in my Neuroplasticity Research Group, so the likes of mirror therapy, cross-education effect, and sensory substitution effect, these therapies can be carried out with low-cost equipment. So mirror therapy with a mirror, with cross-education with a very simple resistance band, sensory substitution with a digital weighing scales. And these things can cost $10 to $15, 10 to 15 euros, and are very affordable in people's homes. So there's no need to have very technical, fancy equipment as long as you're able to carry out safe repetitions of therapies that are safe to carry out. And these are mentioned. There's probably 30 different therapies that are safe to be carried out in your own home. Now, Professor Ian Robertson also gives us some very, very useful information. And Ian has written a fantastic book called The Winner Effect. And in it, Ian mentions 3 advantages that people have when they're in their own home environment. Number 1 is that we should never underestimate the benefit of having our friends and family around, because apparently it stimulates better mental function in us when we're within that environment. So there's better mental stimulation when we have our friends and our families around us, and our morale increases when we're in that sort of environment. And again, I said earlier, when I'm in my own home, I feel like I'm in my comfort zone and I feel much happier and I feel more content. And this probably adds to this finding from Professor Robertson. The second thing is that our brains are very much context dependent in terms of their development. So what we mean by that is that the physical, the social, the psychological worlds that we inhabit, they subconsciously have a huge effect on our brain development. And so when we're in our own environment with the people around us, with sights, sounds, equipment, pieces, that we're familiar with, we're actually much happier. We're much more unlikely to develop the depression, the mental depression that can often happen after an illness. And then finally, Ian tells us that, when we're in an unfamiliar environment, and hospitals can be included in this, that our bodies apparently produce much more of this stress hormone, cortisol, and much less of what he describes as the winner hormone, testosterone. So when we're in hospitals, we're always a little bit under pressure. We feel a little bit stressed. And I think most people have that white coat syndrome where we feel like our blood pressure goes up a little bit because we're always a little bit, feeling that pressure. With medical people, with unusual sounds, specialized equipment around, we feel a little bit uncomfortable. And then you compare that to when you come back to your own home, your own bedroom, your own house, which has its own has its own smells, familiarities. And apparently in our home situation, we produce much more of this winner hormone, testosterone, much less cortisol. So overall, it gives us a much better chance of creating neuroplasticity in our brains. And neuroplasticity, as we said before, is, the rewiring or the generation of new pathways in our brains in response to everything that happens, including those innovative therapies that we just mentioned. So your home can become an ideal place to carry out the next phase of your recovery process after a stroke. And many, many therapies can be carried out very cost effectively with low costing equipment, as we've said. Now, if you want to have some more information, some more extra information and resources that will back up what we've just spoken to, then please go to my website, www.lightsmirrorsaction.com. And there you'll find some extra YouTube videos, you'll find some worksheets and PDF documents that will back up. And also Chapter 4 of Lights, Mirrors, Action discusses many of the ideas and the concepts we've just spoken about. So thank you very, very much for listening.